This video is going to focus on some details of the bones. These are kind of features that are unique to certain bones and some of their details. For example, we'll look at the scapula, the humerus, the femur, and just some of their details. So in the scapula, we have some processes that stick out of the scapula. Think flat like a spatula, because it looks like a spatula. Scapula. Well, the process on the top is the acromion process. Think of like acrobat. It sticks out across the top. Beneath it is the coracoid process. It just means crow beak. So think crow beak might help you remember coracoid. So coracoid just means crow beak. But then there's this like socket where the humerus is going to fit into the scapula. That's the glenoid socket. Just means hollow, like hollow socket. The scapula has a superior angle. That's where the bone kind of arches up and comes to an angle. It also has an inferior angle. So inferior means below. This is the bottom part of the scapula that makes up your shoulder blades. There's a little notch in your scapula. There's a nerve that runs through that. A notch that's called the suprascapula notch. But a notch is just a V shape in a bone. In the humerus, that's your upper arm bone, the head of the humerus is going to fit into the glenoid socket. That's where that articular cartilage is going to be. The anatomical neck has this kind of narrowing part to it. And that's going to unite with the shaft at around 20 years old. The surgical neck is a place that has some more like clinical kind of interest, but it's a little bit lower than the anatomical neck. Tubercle just means bump. So on the superior part of the humerus, there's a greater tubercle that usually joins or fuses around 6 years old. There's a lesser tubercle, a smaller bump toward the epiphysis of the humerus. On the other side, there's some depressions where some of your the Okernon process is going to fit in, and where there's going to be some ligament attachment. But fossa just means depression. The outside of the humerus are epicondyles. Epicondyles just mean a bump on a bump. Medial, if you remember, is toward the middle. Lateral is toward the outside. But you have to remember the skeleton here, these bones are in the anatomical position. So keep that in mind. They typically unite with the shaft around 18 years old. We can measure the width of an epicondyle from one side to the other and get a sense of whether that bone belongs to a male or a female. Trochlea means pulley, and this is where the Okernon process is going to kind of roll around, allowing your arm to bend. There's a little hump in the middle of the humerus called the tuberosity, just an oblong bump. But that's where the deltoid muscle comes down over your shoulder and attaches to your humerus so that you can raise your arm laterally to the side. The femur also has a head, just like the humerus does. Again, the measurement of it can give us an idea of whether the bone belongs to a male or female. Just like the humerus, the femur has a neck, a narrowing part. And then it has a large bump. So instead of the tubercles, the smaller bumps, this is a large bump, so it's called trochanter. The greater trochanter first shows up around 4 years old. The lesser trochanter is going to join by around 18 years old, but it shows up when you're a teenager, young teenager. Just like the humerus, the femur has epicondyles, a bump on a bump. So these can also give us an indication of some things about the bone, but lateral to the outside, medial to the middle. The width of those can give us an idea of whether the skeleton is male or female. These parts that stick out are called condyles. Remember, epicondyles bump on a bump. So these are the condyles. Those are the major bumps. The epicondyle is a bump on that bump. And then just like in the humerus, there's a fossa, a depression. That depression is going to help articulate the leg. So just to review that some bones are axial, some are appendicular. Appendicular bones are arms, legs, and their attachments. So humerus is appendicular. The mandible, though, is axial. The femur is appendicular. The clavicle is appendicular. The sternum is axial. The ilium attaches the femur, so that's appendicular. That's all we have for this video. Thanks for watching.